Hello, everyone. This session talks about the respiratory diseases and illnesses, focusing on COVID-19 signs, symptoms, and prevention. So, our objectives are identify the common respiratory illnesses and diseases. Second, discuss the common signs and symptoms of the very recent and contagious respiratory disease, the COVID-19, and ways to prevent it. So, what are the common respiratory diseases and illnesses? First, asthma. It is a condition in which your airways narrow and swell and may produce extra mucus. It causes wheezing, breathlessness, chest tightness, and coughing. Pneumonia. It is an infection that inflames your lungs' air sacs. The air sacs may fill up with fluid or pus, causing symptoms such as cough, fever, chills, and trouble breathing. Lung cancer. It occurs when the cells divide in the lungs uncontrollably. This causes tumor to grow and reduce person's ability to breathe and spread to the other parts of the body. According to research, it is the deadliest cancer as it causes the highest number of deaths of all cancer. Among of its symptoms are coughing, hoarseness, blood in phlegm, weakness, wheezing, and chest pain. Chronic bronchitis. A long-term inflammation of the bronchi and common among smokers. People with chronic bronchitis tend to get lung infections more easily. It is also a type of chronic obstructive pulmonary diseases, or what do we call COPD. Emphysema, a condition that involves damage to the walls of the air sacs. It is a disease that usually develops after many years of smoking. Next is COVID-19. So let us discuss the signs and symptoms of this disease since it is now a global disease that spreads all over the world. COVID-19 is named as coronavirus 2019. It is a lethal respiratory syndrome that SARS-CoV-2 causes. Severe acute respiratory syndrome coronavirus 2 is the leading and only cause of COVID-19. It is a transmittable pandemic. So how can this virus transmit from one person to another? COVID-19 strains are transferred from the infected person to the healthy person through the air when they inhale the infected person's airborne particles. These virus-containing particles came into the air when the infected person talks, coughs, or sneezes. Touching the area where the virus-containing particles are present also causes COVID-19. It is not penetrable through the skin, but touching the eyes, mouth, or nose can serve as a pathway for virus entry into the body. There are rare cases where viruses transfer from mother to child during pregnancy. So let us proceed to signs and symptoms. Symptoms of COVID-19 vary from person to person. The higher the immunity, the lesser the chances one has become infected with COVID-19. Most people infected with virus will experience mild to moderate to severe symptoms. Symptoms may appear 2 to 14 days after exposure to virus. So in this presentation, symptoms are categorized into 3, the most common, the less, and the serious symptoms. So let's start with the most common symptoms. These are the fever, dry cough, tiredness, loss of taste and smell. The less common symptoms, the sore throat, headache, body aches and pains, skin rash, red or irritated eyes. The serious symptoms are loss of speech, chest pain, difficulty of breathing, and inability to wake. So if you experience the serious symptoms, seek emergency medical care immediately. To avoid ourselves from getting infected with this virus, here are the best ways to prevent COVID-19. First, wear a mask in public. Maintain a safe distance from others even if they don't appear to be sick. Always disinfect. Avoid social contacts. Practice frequent and proper hand washing using soap and water. And stay at home, especially when you feel unwell. This ends my presentation. Remember, prevention is better than cure. I hope you learned a lot from it, and thank you for watching.